Hey, it's Dr. Herzog. Are you guys ready for vlog number 3? I'm on my way into the office right now. Did my 5 a.m. workout with Corinne and ready to go. Okay, so today's crazy and we have Dr. Libby here today doing a case that she's going to be probably in the room for maybe 4 or 5 hours. And then we have a ton of other patients. Actually, this morning, Kellen called me. I was on my way to the office and she said, Doc, we're doing the morning meeting early. We're gonna put you on speaker. So they put me on speaker and they started going through all the patients that we had today. And I was like, okay, it sounds like a good day. And she says, well, wait, let's go through the afternoon. And I said, no way, that was just the morning. And she said, yes, Doc, that's just the morning. And so, you know, it is a crazy day today, and I hope I get a chance to speak to you, but I'm not sure what's going to happen today. And so I hope you like this and learn a little bit about some of the procedures and things that can happen, especially when there's multiple doctors working together. Dr. Libby, she's doing implants, she's doing fillings, she's doing, not sure what else she's doing. But she's got a lot going on today as well. So it should be a fun day. I'm excited.
So our patient has several teeth that are missing. We're going to be replacing all of his missing teeth with implants. This tooth is not quite ready. That's on the upper right. That tooth was just extracted about 2 months ago. We're placing an implant here today in front, and then here towards the back on the upper left side. And we also did a bunch of fillings today. We're doing a crown. The tooth did not end up needing a root canal. And he's getting a makeover in the front the next time he comes in, so stay tuned for that. He's getting all new crowns. And right now we're just making the temporary crown on the tooth we prepared just a little while ago. So this is his temporary crown. All we need to do is adjust it and he is good to go. So this is our temporary crown. We're going to put a final glaze on it once we cement it. Here's the prepared tooth. He had a lot of extensive decay that almost reached the nerve. Did not quite reach the nerve, so we were able to just build up the holes that were created by the decay. And next visit, in a few days, he will get his permanent crown. Let's cement this. So normally when we place an implant, we want to go exactly, we try to go exactly in between the outside and the inside of the buccal and the lingual. But because it was so thin at that point, we're going to come in slightly from behind since it basically comes to a point over here and we definitely can't place an implant into something like a slick point. So we're going to come in a little bit from behind on the palate, right here. Okay, so we finished placing the implant. And now getting ready to suture. We took a post-op CT scan, which is something I always do just to make sure everything's okay and nothing is different in my mind than it actually is in the person's mouth. And both number 7 and number 12 implants were in just about the perfect positions, buccolingual and mesiodistal. So I'm happy with that.
So this is the process of actually making models. Something that's not changed in many years. But when we're doing removable dentures or flippers or temporaries, we make the models right here in house. So we take your impression and then we fill it with this stone material. And you can see Annie's filling up that same impression that went in the patient's mouth is now being filled with stone. And everything's been disinfected and cleaned. And then the stone sets and becomes hard and gives us an exact model of the patient's mouth that we can then work with to make a denture, a flipper, retainers, temporaries, all sorts of things. And so I don't know if this is a process you normally get to see. For all the dentists out there, you know exactly what I'm talking about. But for my patients, there you go. It's really very simple to be able to get a model of your teeth, you know. 3D printers are great, but sometimes this is just a lot easier and quicker. Oh, look, this is a flipper. Let me show you, Evan. This is a flipper. So when we're gonna remove a tooth, you need a temporary tooth the same day that we remove that tooth so that you don't walk out with a missing tooth. And you get this, which is called a flipper, like the dolphin. And it basically is just replacing that. We put it right in your mouth like a retainer. And then it'll replace that one tooth. It looks very nice and natural. Nobody knows that you have it. And it does the job. It's not the most comfortable thing in the world, the implant is. But this will get you by for those few months while you're healing. You see it? Oh my God, thank you.
You're welcome.
That's so nice.
You're welcome.
You know, I'm originally Cuban, but I wasn't born there. But my parents both were. And Adriana went to Cuba and brought me this little souvenir. I'm so happy. I'm gonna put it in the office. You see what's going on here? So you always have to be a detective if you're a dentist. I know that everything's placed right, and I know that it fits because I could feel that it's engaging. But for some reason, one of them wasn't screwing down. So when you look at this, you can see that this screw goes all the way through. See, that goes all the way through. And then this screw here goes all the way through. But when I push on this screw here, it doesn't go through. So something in the angle of the way that this screw is entering is not allowing it to pass through or engage. So now I'll adjust the crown to fit. You know, we do most of our own lab work here, but when we have a large implant screw retained bridge, we have to send that out. And I sent it to one of the best laboratories that's out in California. They have a really quick turnaround time. They work with digital impressions, but occasionally human error can happen, and it can happen here as well. So in this case, the bridge that had the 3 screw holes, you can see, the screws were going into 2 of the screw holes, but not the 3rd. So when I placed it into mouth and tried to screw it on, it wouldn't screw on. And I had to figure out, well, why isn't it screwing in? Was the impression or the digital impression taken incorrectly? Is the implant actually in a different position? But when I took it out of the mouth and started to analyze, you could see that the platform or the screw hole of the front tooth was different than the rest. It looked the same, but when I put the screw in, it didn't fit all the way through. I tried the 3 different screws to make sure it wasn't the screw, and it wasn't And so I called the laboratory, and they apologized, and they'll get it to me within 3 days. So he doesn't have to wait too long to receive the bridge that he was excited to receive today. But, sometimes you might get frustrated with things like this, but really it's just kind of the nature of science, right? And art and science that we have here. So he came in with a big space between his teeth. He was catching food, right? We just unscrewed the crown and put a new one in, adjusted it, and now he won't catch food. So that's as easy as it is with a screw retained crown. And that's why I prefer those, although they are more technique sensitive, you can see. And here's the Teflon, cover the screw. Looks beautiful, like a natural tooth. Do you see this? How pretty this is. Can't even tell. Do you know which one's the implant? I don't know what a
durian.
pupusa is, but apparently I like it.
So it's tortilla with cheese, chicharrones, or it can be mixtas.
I don't like that. There's no way I like that.
No, but it's not like mixtas, cheese, and yeah. And then Venezuelan.
What's that? That looks better.
That looks like, let's see.
Oh boy, that is really cheesy. Arepa.
It looks like an arepa. Huge.
I didn't work out at 5 a.m. for nothing. Gotta keep it tight. All right, it's been a long day. It's dark, it's late. It is, I don't even know what time it is. I think it's 7 or 8 o'clock. We saw a ton of patients today. We did a lot of big procedures. I did full mouth extractions. Several of the patients today, unfortunately, didn't want to have their faces shot, and so we didn't get those procedures, but we did implants, we did full mouth extractions, we did bone grafts, we did a bunch of crowns, we did same-day crowns. Like always, we did a ton of stuff today, and I don't think I have the energy to speak anymore. So I'm gonna let you guys go. I hope you enjoyed it, and I'll see you next week.
I went to Dr. Tatiana several years ago. I had a lot of bad crowns, and she spent 5 hours on me one day, taking off all my old crowns. I didn't feel one thing, and I'm extremely sensitive. She made me have a beautiful smile. Isn't it pretty? I love my smile. And today she just did a crown on the side, all in one sitting. Like, you can't beat it. It's perfect match. And I feel really good about my smile again.